In this Edpuzzle, we are starting with a discussion of moral development. The person we're going to talk about is Kohlberg. His name is right there. And this was the activity he used to create his theory of moral development. So he went around and asked all these people about this scenario. In Europe, a woman was near death with a special kind of cancer. There was one drug that the doctors thought might save her. It's a form of radium that the druggist in the same town had recently discovered. The drug was expensive to make, but the druggist was charging 10 times what the drug cost him to make. He paid $200 for the radium and charged $2,000 for a small dose of it. The sick woman's husband, Heinz, went to everyone he knew to borrow the money, but he could only get $1,000. Which was half of what it cost. He told the druggist that his wife was dying, asked him to sell it cheaper or let him pay it later, but the druggist said, no, I discovered the drug, I'm going to make money from it. So Heinz got desperate, broke into the man's store to steal the drug for his wife. Should the husband have done that? And for this experiment, it didn't matter if people said, yes, he should have stolen the drug, no, he shouldn't have stolen it. That was irrelevant. What mattered is why. Why should he have done it? Why shouldn't he have done that? And so based on what they said, their explanation for the why or why not, they were put into one of 3 levels of moral development. So Kohlberg had 3 levels. Each of these levels was further divided into 2 substages. So let's go over these. The first stage is the pre-conventional stage. Most of the time, this is from about 0 to 9 years of age. You're gonna be in this level. And so again, 2 substages. Substage 1 is about obedience and punishment. You are trying to avoid punishment. Stage 2, it's about individual interest. You're trying to get a reward. So, are you no, he shouldn't have stolen it because now he's going to go to jail, or yes, he should have stolen it because now his wife's going to be really happy with him. That's going to be pre-conventional. The next is the conventional stages. This tends to be early adolescence. And again, you're going to have 2 substages. So substage 3, it is the interpersonal aspect. So you are focused on social approval. Substage 4, it's about obeying authority, conforming to the social order. So trying to make people like you, trying to do what you're told, obeying your authority figures. And then finally, post-conventional, this is going to be adulthood. According to Kohlberg, not everyone is going to get to this stage. And again, 2 substages with this. So substage 5 is about the social contract. And so you're trying to balance the social order with individual rights. And then substage 6 is about universal ethics and internal moral principle. And some other psychologists tend to distinguish between moral reasoning and moral behavior. People can think one thing, but they're going to act very different in their own lives. So just because of what you would say in this experiment is not necessarily how you act in your own everyday life. One complaint with Kohlberg is that he was prejudiced, sexist, ethnocentric. So men tended to score higher on his moral scale than women, and European Western people tended to score higher than people from the East, from Eastern countries. So yeah, according to him, most women can't get past the conventional stage 4. They can't make it to post-conventional. And so another researcher, Carol Gilligan, created a different version of moral reasoning. She said that Kohlberg's theory was based on upper-class white guys, And so when you are thinking about women, they think differently than men. And it doesn't mean it's inferior to men, it's just that it's different. So Carol Gilligan says that women tend to focus more on staying connected and the importance of interpersonal relationships, which is in that conventional stage for him, but that it's not inferior to post-conventional. It's just women need to care more about social relationships than men do. So there is some debate with Kohlberg. So that is it for the main theorists. We've talked about Freud briefly, Erikson, Piaget, Kohlberg / Gilligan. Now we're going to focus on distinct stages of development. So first we'll talk about the prenatal stage. There are several components to the prenatal stage. The germinal stage is from conception to implantation. So conception, when the sperm and egg meet, that creates a zygote, one cell structure. And then that, oh my dog, that occurs in the fallopian tube of the female. And then that zygote, which turns into a blastocyst, which is, the blastocyst is, as the cells are dividing, forming more cells, that travels down the fallopian tube and implants into the uterine lining of the female. That whole process can take up to 2 weeks, about 10 days, and that is the germinal stage. Once implantation has occurred, once that blastocyst has implanted into the uterine wall, now you are in the embryonic stage. And so that is that. It's called an embryo now. That organism that has been implanted is the embryo. And this will be from like 3 weeks to 8 weeks gestation. And what happens in the embryonic stage is when the neural tube forms. That is the precursor to the brain and spinal cord. This is when what is going to become the heart starts to have a beat, and the organs start their very early development. So that is the embryonic stage. During the embryonic stage, the nutrition for the embryo comes from an egg sac. The embryo is providing its own nutrients. But during the embryonic stage, a placenta forms around the embryo. And so once that placenta is complete, and so now the nutrients for the nutrients come from the female instead of that egg sac. Now you have hit the fetal stage, and now you call it a fetus. So fetal stage is when the placenta is now providing the nutrition, and so that's going to be 9 weeks through the rest of the pregnancy until birth. And usually somewhere about 24 weeks is when that fetus would be viable outside of the womb, where the fetus would have a good chance, not a 100% chance, but a good chance of surviving if born at about 24 weeks. Although the average pregnancy length is about 40 weeks. So 9 weeks to 40 weeks is the fetal stage. And so a lot happens during these prenatal stages. And what you need to think about, an important thing in the prenatal stage, are teratogens, exposure to teratogens. Teratogens are any environmental agent that causes damage to the developing embryo or fetus. Lots of things can be teratogens. And so, for example, alcohol is a teratogen. The number one cause of intellectual disability is fetal alcohol spectrum disorder, exposure to alcohol in utero. You can have, so substances like that, like alcohol, cigarette smoke, or nicotine. Nicotine can cause hyperactivity, it can cause low birth weight, it can cause premature birth, Different drugs can have an effect. It's not just substances like that. It can also be viruses. So for example, COVID is a teratogen. They're still figuring out exactly what it causes, but it seems to be connected with stillbirth and premature birth. So get your COVID vaccine if you might get pregnant. What are other ones? Oh, German measles is another one that, again, now we have a vaccine for it. There's no reason for a fetus or embryo to be exposed to German measles. But I had a cousin who was exposed in utero. He's in his 60s. This was before there was the vaccine. And so he's in his 60s, but he has the mental age of a 3-year-old. And he will always have the mental age of a 3-year-old and has to live in an institution. His intellectual disability came from exposure to German measles in the first 3 months of development. You can have stress. Well, that's not really, it's kind of an environmental thing. Stress can be a teratogen as well. If a woman is exposed to something very stressful while pregnant, the child is more likely, it's easier for that child to develop PTSD. Children are loud. So lots of things. The flu, yet another thing you can get a vaccine for, so there is no reason for it. The flu is a teratogen for schizophrenia. If you are exposed to the flu in utero, you are up to 7 times more likely to be schizophrenic. For a lot of these different things, you have to think about the critical or sensitive period. Those are specific periods in the pregnancy during which certain organs develop. For example, German measles causing intellectual disability. That's only an issue in the first trimester. If you are exposed to German measles in the 8 months of gestation, it's not going to affect your brain development. No intellectual disability. It has to be exposure in that first trimester. For alcohol exposure early in the pregnancy, more likely to cause intellectual disability. Later in the pregnancy, more likely to cause the stereotypical facial features of someone with fetal alcohol spectrum disorder. Same thing with schizophrenia. Early, it has more of an impact earlier in the pregnancy. You're 7 times more likely to be schizophrenic if you're exposed in the first trimester. If it's the second half of the pregnancy, it's only 3 times more likely to be schizophrenic. So different periods of time have an effect. And if you are exposed to a teratogen during the germinal stage, it won't do anything. You cannot have a teratogen affect you during the germinal stage because during this stage, there is no connection, there's no physical connection between that blastocyst and the woman because it's just floating down the fallopian tube. And so anything that the woman is exposed to, that blastocyst is not going to be exposed to. You have to wait until implantation for things that the woman ingests or exposed to is going to affect that developing at that point embryo or fetus later on. So teratogens don't have an effect in those first 2 weeks. It's after that that it matters. Okay, and so that is it for prenatal. Next, infancy. So infancy, there's different areas where you're going to see development. You have motor skills. That's your ability to move your body, manipulate objects. There are 2 types of motor skills. You have fine motor skills and gross motor skills. Gross motor skills develop first. These are large muscle groups that control your arms and legs. This is a baby's ability to hold their head and not have a wobbly head. This is the ability to roll over, to sit up, which develops about 5 months. The ability to walk. So these are the large muscles, your trunk, your legs, your arms for rolling over, your neck muscles. The big muscles are the gross motor skills. So those develop first. Then you get the fine motor skills. These are these smaller muscles, the fingers, the toes, the eyes. So for example, if a kid is learning how to write, when they first do it, they are gripping that pencil like this, and it's all messy, it's not looking pretty, because they don't have that fine motor skills in their fingers to hold the pencil and very neatly write their names. This is why they're not coloring in the lines very well when they're young. It's that lack of fine motor skills. Gross develop first. You also have cognitive development. Again, we've talked about Piaget, but now a couple of issues with Piaget. So cognitive ability is understanding objects. It tends to develop slowly as kids mature, is what Piaget said. Some new research shows that Piaget was wrong, and even really young kids, even babies, have more cognitive skill than he would give them credit for. For example, in one experiment done with 3-month-old babies, they had them see a truck that was rolling down a ramp, and then a box was put on the ramp. And so you would assume that the truck would hit the box and stop. But it was the box was set up that it was hollow, so the truck could roll right through the box. And so it looked illogical. It looked like it was doing something that it shouldn't be able to do, rolling straight through this box. And so for adults, if you look at it, you're going to look at it slightly confused. According to Piaget, the baby shouldn't look confused because they can't think enough to know that the truck should stop at the box. They don't have that enough cognitive ability. But as young as 3 months old, the kids would look confused, like this is not supposed to happen. So they had more cognitive ability than Piaget would give them credit for. In another experiment, they did something with dolls where it'd be 2 dolls playing, and then one would jump into an empty box, but then when they opened the box again, 2 jumped out. So there's like, this isn't the number that's supposed to be there. Again, even babies, who according to Piaget don't know enough to know that that was illogical and the wrong number, even babies would look confused if the wrong number of dolls jumped out of the box. So they tend to learn faster than Piaget would give them credit for. Another cognitive thing that happens in childhood is theory of mind develops. Your theory of mind is your ability to understand that people have different thoughts and feelings than you have. So you're able to take the other person's perspective, understand what they're thinking, and understanding what they're thinking, how they feel is different than the way you think and feel. And so we use false belief tasks to study theory of mind development, because if you think about it, if you understand false beliefs, what that means is you understand someone else thinks something differently than you, that you know more than them, so you know the way it really is, and they have a false belief. They think about something the wrong way. So for example, I'm going to show you 2 videos of this. The first video of this is my niece. She was 3 at the time. So this was pre-theory of mind development. And this is a common false belief task where you show a kid, I show her, the common thing is a box of crayons. I think I used a box of toothpicks, yes. And you say, what's in this box? If it's the traditional one, if it's crayons, the kid's gonna see the box of crayons and say, I think there's crayons in that box. You open it and it's like M&Ms or something, it's candy. And then you close the box and you say, if I bring someone else in this room and ask them what's in the box, what are they gonna say? And so a kid that has theory of mind is going to say, they're gonna say it's crayons in the box because they don't know what's really in it. They didn't get to see it. And so they're gonna think the obvious, that it's crayons. That's a false belief. So you can understand that someone else has a false belief. Kids who are too young to have theory of mind, they're gonna say, they're gonna think there's M&Ms in the box because if they think it, if they know it, everyone must know it. So first thing I'm gonna do is show you that version of the theory of mind task right now. Hey Izzy, I have a question for you. This is a box and this says toothpicks. See how that's where it says toothpicks. What do you think is inside this box?
A toothpick.
You think should we open it and see what's inside? What are those?
Candy.
Candy? Are those jelly beans? Do you want one jelly bean? Okay, you can take one.
All of them.
You only get one now, because I have something else to ask you. Okay, so I'm going to close this up. Now, when I first asked you what you thought was in this box, what did you say at the first time? What did you? Before that, when I said, this says toothpicks, what do you think is in it? What did you think was in it at the very beginning, before you saw inside? Did you think it was toothpicks before you looked inside? Yeah, and then when you saw it was candy, now you know that there's candy inside? Okay, if I have your mommy come in and I ask her, what's in this box? What do you think your mommy's going to say? What does your mommy think is in this box?
Candy.
She's going to think there's candy? Okay, let's ask your mommy. Okay, Izzy's mommy, what do you think's in this box?
Candy.
No, it's toothpicks.
She thinks it's toothpicks. But
I think it's candy.
you think it's candy. Yay! Okay, you can have one more. And Izzy, how old are you?
3.
You're 3. Okay, great. And then for the next one, I'm going to show you the Sally Ann task. And so the Sally Ann experiment is, as you'll see, it has to do with dolls playing, and one hides their marble, and then the other doll moves the marble. When that first doll comes back, where is she going to look for her marble? If you have theory of mind, you understand that the doll is going to look where she originally hid it, because she doesn't know it's been moved. And so now watch this version.
The classic test for mind reading is called the Sally Ann. It's a test that normal kids are expected to pass when they're 5 years old.
Who'd like to go next? Right, okay, this is Sally, and this is Anne. Which one's Sally?
This one.
Well done, right. And Sally has got a basket. And Anne has got a box, nothing in it. And Sally has got a marble. And Sally puts her marble into her basket to keep it safe while she goes outside to play. But while Sally's outside, naughty Anne moves the marble from Sally's basket into her box. Naughty Anne. So where's the marble now?
Box.
Good. Where did Sally put the marble in the beginning?
Basket.
In the basket. Well done. So when Sally comes back from playtime, where will she look for her marble?
In the box.
In the box.
Robert should have said the basket, because that is where Sally, in her ignorance, would have thought it was. He hasn't mind-read the situation from her point of view. What is it about the autistic brain, which means that children like Robert may never be able to mind-read like the rest of us?
And so as you saw, the people develop theory of mind about like 5. By 5, you tend to have theory of mind. An exception to that is kids with autism. Kids with autism do not develop theory of mind. So someone with autism, even as an adult, theory of mind is not something they have very well. And so what they're interested in, the way they feel, it's difficult for them to understand that other people feel differently, other people think differently. They can't put themselves in someone else's shoes. They can't have that theory of mind. And so that is it for that. Final thing for this one is language development. For language development, again, there's milestones here. You tend to coo, then you babble, then you say one word, and then you can put 2 words together. What I'm going to focus on is Skinner versus Chomsky. So Skinner said that you learn language through reinforcement. Kids say ma, 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 and the mom gets real excited. So that's how they learn mama. Chomsky says he focuses on the LAD, the language acquisition device, which I briefly mentioned in chapter 1, where you are sort of, you have an innate ability to learn language, especially grammar, which is why universally kids hit these language milestones about the same time. And we are going to stop there for this video. So this one's not too long. And the next video, we will start talking about attachment.